Ever wondered if ginger, a common spice in many of our kitchens, could pose any health risks? It's a question that deserves some attention. While ginger, celebrated for its rich flavor and numerous health benefits, is a staple in many homes, it's not always the go-to for everyone. Certain health conditions may not react well to its potent properties. From bleeding disorders to diabetes, gallstones to heart conditions, and even pregnancy, ginger might not be your best friend. Stay tuned as we delve into the potential health risks of consuming ginger. Before we get started, make sure to hit that subscribe button and hit the bell icon to stay in the loop. Let's get started. First on our list is bleeding disorders. Now, we all know and love ginger for its unique flavor and health benefits, but it's not for everyone. Specifically, those with bleeding disorders might need to exercise caution. Why, you ask? Ginger, you see, is a natural blood thinner. It contains salicylates, the chemical in aspirin that acts as a blood thinner. Now, for most of us, this is a good thing. It can help prevent blood clots and reduce the risk of heart disease. But if you have a bleeding disorder, your blood already has trouble clotting. When you add ginger into the mix, it can potentially interfere with the clotting process even more. This means that a simple cut could turn into a serious issue, as your blood may not clot as quickly as it should, leading to excessive bleeding. So, if you have a bleeding disorder, it's best to consult your doctor before consuming ginger. Moving on to diabetes and gallbladder issues. Ginger, a beloved spice with a myriad of health benefits, can also pose challenges for individuals with certain health conditions. For instance, those managing diabetes might need to exercise caution. Why, you ask? Ginger is known to lower blood sugar levels. Now, this could be a boon for some, but for diabetics already on medication, it could potentially lead to hypoglycemia, a condition characterized by dangerously low blood sugar levels. Switching gears, let's talk about gallbladder issues. Ginger has the ability to stimulate gallbladder contractions. While this might not pose a problem for most, it could be problematic for those with gallbladder disease. These contractions could potentially exacerbate symptoms or complications. In essence, while ginger is a fantastic addition to many a dish and even natural remedies, it's not for everyone. So, for those with diabetes or gallbladder issues, caution is advised when consuming ginger. Heart conditions, medication interactions, and being underweight are next on our list. Diving straight into heart conditions, it's important to note that ginger, while a powerful and beneficial root for many, can lower blood pressure and slow blood clotting. This can pose an issue for individuals with heart conditions. These effects of ginger may amplify the issues associated with heart conditions, potentially leading to complications. Therefore, if you're dealing with a heart condition, ginger might not be your best ally. Now let's talk about medication interactions. Ginger is a potent herb, and like many other herbs, it can interact with certain medications. This interaction can alter the effects of your medication, which can be problematic. For instance, ginger might interfere with blood thinners, diabetes medications, and high blood pressure medications, changing how these medications work in your body. The consequences of such interactions can range from mild to severe, depending on the medication and the individual. So, if you're on any medication, especially for chronic conditions, it's vital to discuss with your healthcare provider before adding ginger into your diet. Lastly, we come to being underweight. While ginger hosts a multitude of health benefits, it can also suppress appetite. This could be a blessing for those looking to lose weight, but not so much for those who are underweight or trying to gain weight. If your goal is to pack on some pounds, consuming ginger might make it more challenging for you to reach your calorie intake goal, as it could make you feel full sooner, reducing your overall food consumption. In essence, ginger carries a myriad of health benefits, but it's not for everyone. Its impact on heart conditions, potential to interact with medications, and its appetite-suppressing properties could make it less than ideal for some individuals. If you have heart conditions, are on certain medications, or are underweight, it's best to consult with your doctor before consuming ginger. Last but not least, we have pregnancy, low blood pressure, and surgery. Let's start with pregnancy. While some pregnant women use ginger to alleviate morning sickness, it's essential to tread lightly. There's a concern that consuming ginger can affect fetal sex hormones and even contribute to miscarriage. However, research is still ongoing, and the results are far from conclusive. That being said, it's better to err on the side of caution. If you're expecting, talk to your healthcare provider before making ginger a regular part of your diet. Next up is low blood pressure. Ginger is known for its blood-thinning properties. This means that it can lower your blood pressure, which might sound like a good thing. But if you already have low blood pressure, consuming ginger could potentially drop it to a dangerously low level. So, If you're someone with low blood pressure, consider discussing with your doctor before adding ginger to your meals. Finally, we come to surgery. The blood-thinning properties of ginger can increase bleeding risk during and after surgery. It's generally recommended to stop consuming ginger at least 2 weeks before a scheduled surgery. Of course, this is something you'll want to discuss with your surgeon or healthcare provider. So, if you're pregnant, have low blood pressure, or are about to undergo surgery, it's best to consult your doctor before consuming ginger. Now that we've covered the potential health risks of consuming ginger, let's summarize. Ginger, while a powerhouse of benefits, may pose risks for those with certain health conditions. If you're dealing with bleeding disorders, ginger might exacerbate the issue due to its blood-thinning properties. It could potentially interfere with diabetes management and cause complications for those with gallbladder issues. Heart conditions, certain medication interactions, and a state of being underweight could also be negatively impacted by ginger consumption. Additionally, those who are pregnant, have low blood pressure, or are about to undergo surgery should exercise caution. These conditions may be aggravated by ginger's potent effects. The key takeaway is that while ginger is generally healthful, it's not universally beneficial. It's crucial to consult with your healthcare provider before incorporating ginger into your diet if you have any of these conditions. Remember, while ginger has many health benefits, it's not for everyone. Always consult with your healthcare provider before adding new foods to your diet, especially if you have health conditions. Stay safe, and thanks for watching.